So let's start with you, Dr. Neblett.
Sure.
Introduce yourself and just tell me a little bit about yourself.
Sure. I'm Michael Neblett. I grew up in a small town in Middle Tennessee, traveled across the long state of Tennessee to East Tennessee, went to East Tennessee State University for college and loved it so much I stayed there in the Appalachian region for medical school for 4 years and wanted to come to a different experience, so moved to Georgia, and I'm a PGY4 here now.
All right. I'm Dr. Olatunji, Damilola Olatunji. I was born and raised in Nigeria. I moved to the U.S. at the age of 10. So home is Atlanta, Georgia, in the United States. I left for college. So right after high school, I wanted to get a different experience. I attended Brown University for undergrad and moved to the D.C., Maryland area after that for research at the National Institutes of Health. Got a master's degree from Georgetown, made my way over to the Midwest and attended medical school at the Ohio State University College of Medicine, and then made my way back home here to Atlanta, Georgia for residency.
That's amazing.
Oh, yes.
So you have definitely...
Long travel, more than me. I just traveled south a little bit.
So, I mean, I think that that's the best first way to sort of start figuring out, like, if you've been to so many different sort of environments, what was it about Emory that made you want to train here?
So there are many different reasons that I wanted to train at Emory, and I like to describe it kind of like a cake. I'd love some cake right now, actually. Yes. But let's think of a cake. You have the main cake itself, and then you have the icing and all the decorative pieces of the cake. For me, the main cake itself is Emory University as an institution in the GYN OB division. And as a department, it's just a strong department. It's just lots of good training that happens here. And I know that not just by looking at the website or looking at what Emory itself puts out, but by speaking to people who have experienced Emory. So prior to coming here, I made it a point to reach out to other individuals that had trained at Emory years ago, so say 10-ish years ago, and then individuals that recently trained at Emory, just to get an idea of what the experience really is like. And based on what I was hearing, it sounded like I would get a very strong training background here. That's the main cake. In terms of the icing of the cake, as mentioned, Atlanta, Georgia is what I consider home. And so it was very important for me to make my way back here and to give back to the community that I consider a community that was part of my upbringing. And so that's the icing and that's the decoration.
Now, you had a little bit of chance to try that cake a little bit, didn't you? I think you did a visiting rotation here. Is that right?
I sure did, Dr. Neblett. And so during my 4th year of medical school, I made it a point to do a visiting rotation here as a medical student. The goal with that was for me to determine whether what I had read about Emory, what I had talked to other people about Emory was really, legit and it felt right. And so I like to experience things myself. I like to go with my gut. I like to really pay attention to how I'm feeling when I'm in a space. And the month that I spent here last summer during my 4th year as a med student was phenomenal. I got to meet so many different residents and work with so many different residents. I met you last summer.
I know. I remember that.
And it just felt like home. And that's very important for me. Residency is difficult. And so to feel like I'm surrounded by people who support me and to feel like I'm in a space that feels like home was huge. So
I'm the same way. I mean, I can remember back 4 years ago, I had the opportunity to visit Emory as a visiting medical student. And the biggest thing that was memorable to me was the residents. It was such a great opportunity to watch other residents, senior residents, teach junior residents. Anytime that there was free time, whether it's going to the cafeteria or after rounds, there was education, was teaching, was going up, pulling up a PowerPoint. And I didn't see that a lot in other places. And so that was one thing I knew what I was kind of getting myself into coming into residency. That was very important to me. So many times you see senior level residents really taking charge and being great leaders and mentors to junior residents, not only with work stuff, but also outside of work and sort of life stuff, the real life stuff. It's sort of special that I had a chance to experience firsthand here. Another thing was the diversity. We talked a little bit, I'm from a small rural town. I actually grew up in a town with less than 2,000 people, no red lights, very, very small. And so, yeah, it's very, very small, very, very small. And so, even though the Johnson City was a little bit bigger than that, I really wanted to train at a place that offered a great deal of diversity. That was really important to me. Diversity is really in the faculty that we're training with. Having exposure to fellowships was important to me. I didn't know what I wanted to do coming into residency, but thought that I wanted to do something in academics and teaching. And so obviously that seeing the atmosphere of teaching was the first thing I drew here, but I wanted exposures as well. So fellowship was really important. Diversity also in the patients. At Emory, we now go to 6 different hospitals now. And so that's a lot of traveling, but you see a lot of stuff that's, in my 4 years, looking back and sort of comparing to other programs, I'm not sure if I would have got that same exposure anywhere else in the country. So this amazing opportunity, just taking care of so many different patients from various backgrounds, different countries, different languages speaking, using interpretive services. Like these are all kind of things that was great to learn. So.
I'm really glad you brought that up because that's one of the things that I paid attention to when applying to residency programs. And so for those who don't know, the city of Atlanta is 52.2% Black/African American. And as a Black woman in medicine and underrepresented minority in medicine, for me, it was important to train in a city where I felt like I could give back to my community as well as other individuals that do not look like me. And for me, Atlanta matched that really well. And to your point about the diversity of the faculty members, when I was a visiting medical student here and I would show up for ground rounds on Wednesdays, it really brought joy to my heart when I would walk in and see so many different types of people, especially the Black attendings, the Black women I saw in the room, people that I saw in the future serving as really strong mentors for me, in addition to the other attendings that did not necessarily look like me and probably do not have the same experiences as me that can also serve in mentorship roles in that aspect as well. So that was really, really huge.
Absolutely.
Yeah.
It's sort of a huge teaching. It's always continuing education. So I feel like, this program is, you can learn from the faculty and the faculty can really learn from you. So we're really lucky to have you here. So
I'm lucky to, have you. So Dr. Neblett, being that you are not towards the end yet, but you're in your last year of residency training, give me an idea of what your experience has been like so far, if anything has surprised you, things like that.
Absolutely. So I think that Emory has a great training program with the 3 big pillars of sort of well-rounded education. So I think starting first clinically, we've had some excellent mentors in the clinic, and looking back, you have such a amazing opportunity at the Grady Clinic that you have your own resident clinic, that you really get to know these patients and follow them for some continuity. You're seeing them, very often for their OB appointments. You see them in GYN, and when you're on the service, you schedule their surgery. You see them for post-op check. I have an opportunity to actually follow up their pathology and contact them and see how they actually, are healing post-op. There's so many specialty clinics as well for all the fellowships, and having early exposure, which was such an incredible opportunity, especially if someone interested in fellowship, from REI clinic to MFM clinic, gynonc, family planning, PAG clinic, and then Urogyn later in the 3rd year. You have such early exposure. In the OR, it starts out early. July 1st, I'm sure you know, July 1st, we have really good residents here and we recruit really good residents. And so we really want to get you involved in the OR very early for obviously appropriate level of training cases. And so I remember starting out really in July, labor and delivery, and being involved in C-sections. Just a few months later, on GYN at Midtown, being able to do some hysteroscopies, DNCs, that was really motivated me for residency. And then later in research, early on in your residency program, the first year you have an opportunity to pick a research project and pick a research mentor. There's not a lot of rush, but you have a year. And then in your second year, you sort of develop your project. 3rd year, you do sort of the project itself and the statistics. And then 4th year, you present it in resident research day. And so for me, like looking back in 3 years, I am just so thankful for the opportunity and feel like I'm getting a rounded education, feeling very comfortable in the clinic. OR technically developing great skills, and research is something that coming into residency I didn't have a lot of experience with, but now as I'm applying to fellowship now and looking back, I'm just so thankful for opportunities in my research mentor here at Emory to be able to give me opportunities. The biggest surprise I think for me is it was really the residents. When you interview different programs, everyone says the residence is like why I want to stay here. The residence is like what makes this program. And for me, it really was the residence. Like obviously having that early exposure with my visiting rotation, but for me, it was like, you know, for example, like my wife is such an important person to me, and so she is friends with everyone here. And so not only do I like, you know, relax from a busy week and spend time with my co-residents, but my wife comes along too. And now my 1-year-old daughter the co-residents, like this is my family. Like they threw me a baby shower and it was so amazing with that. So, I mean, I love it every single day.
That's beautiful, and it's so heartwarming to hear your experience as you've been through this, and me as a new resident, to resonate with some of the things you've said, and then to see some of the things that you're saying that I haven't experienced yet that I absolutely look forward to experiencing. My first rotation was also labor and delivery, so we have that in common.
Yes.
That was my first 6 weeks here at Emory, and like you mentioned with the residents, that really stuck out. So as a new resident coming in, I'm a new physician. I'm getting used to walking in a room and, you know, introducing myself as the doctor. Having senior residents that supported myself and my co-intern through that with 2 interns on the labor and delivery rotation. Senior residents that we could go to with any questions and not feel like any question was too stupid or not feel like we were intimidated to ask anything. So that transition was so smooth, and it was an absolute blessing to have who we had on the team. And the other thing that I wanted to point about that is how much I was able to see Emory supporting residents who are pursuing fellowship. And so my senior resident, my PGY4 on my Grady labor rotation, is currently pursuing a fellowship. And so I got a chance to work with other senior residents that came in to cover for her because Emory allows that to happen. Mm-hmm. You were one of those senior residents. Yes, I do. And so I got a chance to interact with so many different residents and see how fluid the process can be while Emory supports the residents to, you know, interview for fellowship like you are right now. And on our current rotation that we have together, just seeing that it's not necessarily okay, fine, you can go interview. No, it's a we're going to encourage you to do that and to pursue your dreams and to get your ultimate goal in terms of your career. Oh, yeah. And so I absolutely love that.
Mm-hmm. That's so true. You know, another thing I was just thinking about was something that surprised you was just the amount of things that you feel comfortable with.
Yes.
I mean, it's looking back, I mean, I would not think that some of the things that you learn, you're developed in such an excellent resident here at Emory that things that you think would stress you out, you're just very calm in these situations. So I think looking for anything, that's like been the biggest thing.
Oh, yeah. I totally agree with that. By the end of my labor rotation, I was like, wait, someone asked me a question and I don't hesitate to answer. Yeah. Oh, order Tylenol. Sure.
Absolutely. I think on the outside you see more gray hairs, but I think on the inside I'm way much more calmer and age.
And I absolutely look forward to getting to that point after 4 years of training. And so that's just another beauty of what Emory brings to the table in our training. So, yeah.
So outside of training, obviously, working hard, you're at work a lot. What do you do to, like, in your first couple of months, what do you do to sort of have a good work-life balance at home? I mean, how do you relax? What do you do to sort of get away from work?
Hashtag self-care. Lots of sleep, paying attention to my sleep schedule because I know myself and I know what it takes in terms of my rest and what it takes to get me to the level where I want to perform at my best. Mm-hmm. And so making sure I'm getting that rest, making sure I'm using my family as a resource. They are extremely proud of me. They're here in the Atlanta area. And so having them right there, talking to my fiance about any stressors that come on because he's always just such a good support system for me. And he's a very logical person. And so I function a lot on emotion and he functions a lot on logic, and he's able to bring that balance for me. So when things are stressful or when things get, ridiculous, I'm like, oh my goodness, this is a lot. Like it's going well, but this is a lot. I can always reach out to people in my family as well as my fiance and then my co-residents. They've been fantastic. We actually got a chance to link up a couple of times before residency started, and so we got a chance to build our bond even before orientation. And they are such a good resource for just relaxing and doing things outside of work. Just hanging out. And our group chat, it's honestly, I'm just going to say it might be the best group chat. I don't know. I'm sure the other classes have great group chats, but ours is probably the best.
I know every time that whole week, the 2 weeks that you have before residency starts, that you have that welcome orientation, it seems like every single night I would see all 9 of you like on social media posting. It's like I knew exactly what you were doing at all times. So I was like, this is great. They're actually having fun before residency.
Oh, yes. And because once residency starts, things are going to get busy, and we're all going to be at different stages and on different rotations, but we always have that home base, and we just all bring it back together, support each other through whatever it is we're all going through. So it's been really beautiful.
I think it's great that 9 people with various backgrounds that you probably maybe on the outside have nothing in common at some point in their life for 4 years are together, many hours actually, that you develop these bonds, and that, looking back now, that they're some of my best friends that I know that I'll be in contact with texting me, hey, what's going on? How do I do this?
Yes.
In the years to come. So
yes. And you mentioned how supportive your co-residents are in terms of your family life and throwing baby showers. And I call your daughter, my niece already. She's so adorable. And so just having that bond with people, I think makes residency that much better, because we work hard. That's a fact, and that's not going to change. But having that balance is definitely huge. So what kind of things do you do in terms of after work and balancing life?
I'm the same way. I think it's very important to me to turn my brain off whenever I get home from work. That's a hard skill to do, and I think you sort of develop, through time. But I try to spend at least 30 minutes to an hour devoted to my daughter before she goes to bed. I have that time with her, and so really just instill in her mind that a father figure and a dad and stuff. So that's really important to me. Usually I'll put her down, and then I'm not gonna lie, I watch a little bit of reality TV sometimes to sort of get the mind off of work, and then kind of, if I have notes or stuff later in today, I'll do it. But I think that having a partner like Grace that's really supportive is nice. That being said, there's plenty of residents who don't have partners, and there's so much stuff to do in Atlanta. It's an amazing city.
Oh, yes.
Some of my favorite things are going to the Silver Common Trail. I live a little bit outside the perimeter, and so walking, biking is so much fun. Going to Battery Park, there's so much things to do there with the Braves baseball teams, restaurants. They have stuff for kids that's there. So just sort of doing some self-care and relaxation afterwards. Obviously, it's also important after a rotation that you have some self-care. And so I'm not going to lie, sometimes I'll get a massage sometimes, but
that's something I need to add to my schedule.
You definitely should.
For sure.
Definitely self-care.
And good point in terms of mentioning the different things that other residents do. I know some of my co-interns, when they have a weekend off after a rotation, they go out of town. Some of them have partners that are in different states. And so the fact that they're able to continue that despite how hard they work, I think is really nice. So, yeah.
And I think this is a good place to mention, you guys have talked about your relationships with your co-residents. Talk to me a little bit about how the faculty relationships are developing. What role is mentorship playing in your resident experience?
Oh, absolutely. As mentioned earlier, the faculty members that I met while I was having, the initial taste of the cake here at Emory, they made a huge difference in terms of solidifying my desire to train here. And so after officially becoming a part of the Emory family, I, got to see a lot of those faculty members again, and I've gotten to work with them and rotate with them, other faculty members that I did not meet last summer, and everyone has been so welcoming. Everyone is really good with teaching and making sure that they play their role in terms of getting you to where you want to be in your career and making you a strong, solid clinician and someone who has the medical knowledge it takes to get to that point. And so faculty members here, I don't think make me feel intimidated to ask anything. I think that everything they do is for the betterment of me as a physician. And so my experience so far has been really wonderful. And then I touched on this a little bit before, but also as a Black woman in medicine, I've gotten a chance to just bond with so many other women that look like me in the department. I think that's very special. And I think that's something that I can't even overlook if I tried, because they make it a point to be there, and they make it a point to say, you know what, we are here as a resource. And then other faculty members who don't necessarily look like me, who, especially those that remember me from last summer, they've been just so welcoming and so good with teaching and so good with making me feel comfortable in this new role as a physician. How about you, Dr. Neblett?
Well, I always say that I am who I am because of mentorship. Growing up in a small town from a low-income family that struggled with health issues and drug addiction. I am who I am because of mentors. So I wanted to train at somewhere that had mentors for me. no matter what I decide to do with my life. And I think that this residency program does a great job with just from day one. Like, you were assigned a small group mentor with you, and from one person from each class that you can get together, go in a quiet area, meet up for fun, wherever you want to go. We recently went bowling. That was fun. That you can just have it just a way, ask whatever questions that you want. Just get anything off your chest. Ask what questions you think may be dumb or whatever. But that you have a chance to learn and ask upper level residents. And so not only do you have that small group mentor, but it's sort of like Emory challenge you along the way, as far as even with research, they give you a mentor or encourage you to find a mentor. You're going to be giving grand rounds in your third year that you pair with a mentor. No matter what specialty you go to, we have basically everything here at Emory. And so there's many mentors, and really it's really easy to kind of go up and ask someone that I've seen. It's so easy for us to be sort of scared to ask, sometimes people of seniority to ask them things, but in the past 3 years or so, it's been so easy. If I need something or ever need anything or I have a question, it's so easy to go up to someone and ask them for help, advice, kind of what they would want to do. So, and there's just such huge diversity of mentors here.
Yeah, I love that. And to your point about just how stress-free it can be to get a research mentor, because research is an aspect of our training. I'll give a specific example. I'm already thinking about my RD project, and as residents, we work on research, as you mentioned. And so as these thoughts are floating in my head, I reached out to our faculty member who was in charge of research, and as soon as she heard what the idea was, she immediately had an idea for who I can reach out to serve as a faculty mentor. All it took was one email, and we already have a meeting set up to discuss what the idea is. And so it was literally the most stress-free process ever. And so I think that says a lot.
I think with your point of how quick it is, for me personally, I'm interested in pursuing an REI fellowship. And so once I had that early exposure to REI and found out this is what I would do as a career choice, I told one person in the department. It sort of everyone knew about it, and all these opportunities came for opportunities to hear about more research opportunities and to sort of get exposure to REI, and now applying to fellowship. It's so easy. I can text someone in the department and say, "What do you think about this program or these people or whatever," and get immediate feedback. So it's been very, very helpful.
Yeah. The other important thing about a program is its program director, and having a program director you feel you can reach out to. Mm-hmm. And so with Dr. Arluck being our program director, she made it clear on day one of orientation, if there's anything you all ever need, please do not feel, intimidated or feel like you can't reach out to me. And so I think having that open line of communication has also made a difference. As new residents, in the beginning, we had no idea what was left, what was right, what was up, what was down. And so having that with our program director and our assistant program directors, Dr. Risk and Dr. Davenport, they've been so open, and they've just been people we know, and I'm comfortable speaking on behalf of my class about this, people we know we can reach out to and just be comfortable asking questions and anything that we feel like we need clarification on. So
I completely agree. And that was just a change that we saw, the addition of 2 assistant program directors. I'm anxious. It's such new. I'm anxious to see how that changes things, and just the openness and easiness to talk to someone. So
absolutely. And they constantly check in on us. How are you doing? How are things going? And I think that makes a big difference. It's not like, okay, you started residency, good luck. See you at the end. So yeah, it's been beautiful.
Nice.
Mm-hmm.
Well, and I think you all touched on this, but I'd love to hear more. So when you're talking about sort of how faculty are mentoring you and you think about what your future goals are you in a place, you're certainly on the other end of the spectrum, but, knowing what your future goals are, how is Emory and this department sort of supporting you and walking you through that process to get to your goals?
So for me, I am very new to this, and so I'm still trying to figure out what exactly I want to do in the end. Right now, I'm thinking I would go the general route and the academic medicine route. And so being at an academic institution is a great thing for me right now, because there's so many amazing brains I can pick in terms of what it means to be an academic physician. And so I feel like there are many different faculty members. I need more hands to count them, more fingers, more toes that I can just go to and ask, okay, so what is it like to be an academic physician? What does it take to become an associate professor, an assistant professor? What do these steps look like? For someone like me who has been in leadership for as long as I can remember in everything that I've become involved in, it's just about that proactive question asking. And so far, I've been able to ask all different types of things and just add to my arsenal. And so that's adding to my future goals in terms of my career in medicine and leadership.
Mm-hmm. Yeah, and it's just, looking back at the word I keep thinking about is opportunities of Emory. I mean, I was sort of like you. To me, like I had so many people that were mentors and teachers to me that I knew I wanted to give back in academic medicine and knew that I wanted to do that going in, but really fell in love with the fellowship program over the REI my second year. Like it was one of my first rotations. And I think I told Dr. Spencer, she's like, "Wait, you want to be an IVF doc?" And I said, "Yeah." And she's like, "Well, that's great." And then, they paired me with a medical student. We was able to work on a project with her for her discovery project. I had one of the other, Dr. Hip, she came up and wanted to write a review article. With my RD, I'm able to work with people in the department as well. Dr. Spencer, who's been a mentor to me. So kind of all that together, like just people are so just forthcoming to helping you out in the whole thing. And I'm always getting updates like, how's the interview process going? How's the traveling going? Like, what do you think? Like, it's just such great support we have.
Yeah, absolutely. And I feel like even if I do change my mind and decide I want to take the private practice route, or if I wanted to do fellowship, to your point, I think the resources are there.
Mm-hmm.
And I wouldn't feel, I changed my mind and now everything is changing, everything is different, I'm not going to get where I need to be. And absolutely not. I feel like no matter what I decide, I have people I can always reach out to about it.
And I think looking back historically, this residency program, at least half of people go into fellowship. So, and have matched a tremendous program. So I think that gives sort of looking at the history of Emory, like where we've matched people at for fellowship. I mean, that was so important to me as someone who was considering fellowships maybe as a career. We had people go into a lot of great, high, like well-known academic programs. At the same point, for my class, actually the majority are going to be generalists, which I think is awesome because we need great generalists, especially around Atlanta, but all over the country. And with that, like there's so much mentorship for even job placements. A lot of my co-residents are already either have jobs or are looking to sign a contract pretty soon, even early. So I think you have great opportunities.
Yeah, and that says a lot considering where you are in your fourth year. It would be considered towards the beginning, and knowing that people are already solidifying their futures and not having to wait till the very end and the stress of everything being last minute. That's an amazing thing, especially with fellowship interviews and balancing that with the generalist route. So it's great. So we have different experiences in terms of daily activities, and we're on different rotations. And so not every day looks the same in terms of our training. But I wanted to get an idea of what a typical day for you would look like. I know right now our days are similar because we're on the same rotation, but what would a typical day for you look like?
Yeah, and then to your point, it depends on the rotation that you're on. So for a typical GYN rotation, I'm a big fan of sleeping in as much as possible. And for me, that's usually 6 a.m., getting up, doing self-care, shower, getting a great breakfast before starting the day. Then typically I'll go in and round on my patients to see them. And I love being able to see patients that you operate on post-op because you learn that way, and also these patients really get to know you and are trusting of you. So seeing patients, and then typically after that I'll go straight to pre-op patients for that day's particular surgery, or go to clinic if I'm in clinic that day. You may be in the whole OR or whatever all day long, or you may be in clinic. Afterwards, usually I'm a big fan of keeping in communication. So usually we'll be in contact with some of the residents that are on the service with you to sort of meet up. I'm also a big fan of free food. I think any resident appreciates that. And there's a lot of opportunities to have some free food at certain times at the hospitals that we work at. So meeting up, sort of getting free food, having self-care, winding down from the day, talking about things to be done. And then, like I said earlier, I go straight home, spend some time with my daughter, and then if I need doing notes after she's in bed, I'll do that. But I try to have everything at work done, so when I go home, I can sort of relax and have some self-care.
And I love that you mentioned that, because what I've experienced so far in my 9.5 weeks of being a part of the Emory family is how much the upper level residents and the leadership and the faculty members emphasize the importance of leaving work at work. Oh, yeah. They encourage us not to take things home, and so I love that you make that a point to try to leave work at work as much as you can. It's not always going to be possible, but when you can, it's lovely that you do that. And so yeah, for me, I'm gonna speak from the perspective of labor and obstetrics. And so a typical day on labor looks slightly different from a typical day on GYN.
It's a little busier.
It's busier. And I love that aspect of it. That's part of what drew me to OBGYN, is the fact that your days can be drastically different. My brain is always going. I'm always thinking about something. I have 3 tabs open at least every minute. And so multiply that by the number of minutes in a day. And so I love that there are busy rotations, and then there are rotations where you get to relax a little bit more. And that balance is key in terms of the specialty. And so on labor, a typical day would look like showing up as an intern. You would show up in your postpartum round on your patients, the deliveries from, previous days if they're still in-house. Make sure they're good. And then there is the team sign out. And so you have night team and you have day team. And so signing out in person, face to face, is very important. And I love that we do that, because it cuts any or not all, but it cuts most chances for miscommunication, making sure that patient cares at its best. And so making sure we do those team sign-outs, I love that part of the day. Something else that I really love that we did during my labor rotation is some education during our team.
Yeah, I think we just started that.
Oh, yes. I absolutely love it. So the senior on the night team always had some kind of little nugget of knowledge relating to something that happened overnight or something with one of our patients. And that was really great, because it just adds a stress-free way of putting an education into sign out. And it's things that I'll remember moving forward, just because it's not just you're bombarded with a bunch of articles or anything like that. No, it's in person, conversational. This is just, what happened. Let's talk about it. Let's talk about this type of disease process or this type of, finding during labor. So I think that was really phenomenal. And then after that, patients are giving birth left and right. Yeah. You're having C-sections, you're having vaginal deliveries, you're having, urgent care type for pregnant patients. And it's a lot. And I love it, because you blink and the day is over, because you've just done so much. And so that's a typical day on labor. And then you sign out with the night team, you go home and possibly eat dinner. Just kidding. Always eat dinner. And then just do whatever else. For me, whatever else includes deciding whether I want to go to sleep or whether I want to watch TV. So I do have that guilty pleasure of some shows that I try to keep up with to turn my brain off, like you mentioned earlier. So.
And I think that one thing with the schedule, I had the opportunity to be the Jeopardy resident last rotation.
Yes, you did.
So that schedule is completely up to chance. But was started because of resident wellness, which we have a big, important, it's kind of our goal at Emory, is to be well-rounded, and wellness is part of that. So, so when I was on Jeopardy, the chiefs would contact me the day before and say, this is where you're going, this is what you're going to do. Ta-da! And for me, it was fun, because you get to operate with co-residents, double scrub. You can jump around. You can see how people are learning. And especially in July, seeing all the new interns, it was great to meet various people and stuff. So I love my schedule, and even though it was chaotic.
Oh, yeah. And we got to work with you on labor a couple of times during that Jeopardy rotation. Awesome.
Well, I think one of the things that I'm interested in hearing from each of you is, if you were speaking to a future resident, do you have any advice?
Oh, so much advice here.
to prepare them for this phase of learning? Because you talked about, it's a lot. There's a lot of things happening. And so if you could impart some tips or tricks or advice about how to transition into this phase of learning, what would you say?
Well, we talked a lot about self-care. So I think I would say calm down as the biggest thing, because as soon as you match, the first thing you think is, I need to read this book chapter. I need to know all of this coming into residency. People are going to think I'm dumb. I'm not smart. Take time for yourself. Enjoy the rest of your 4th year of medical school. That's the best time of your life. I mean, travel, have fun with your friends. Then residency starts. And so not that there's not time, but your work, you do work a lot. So that's any residency program that you go in the country. So, but just I would say, don't get ahead of yourself, and don't overthink things is the biggest thing of advice I have. That as a new resident coming in, at least into our program, you're not expected to know everything. You're not supposed to really know anything. You're not even supposed to know where the bathroom is at, to be honest with you. That's kind of the first day is kind of getting oriented and stuff. And that everyone comes in, it's sort of a clean slate. There's no expectations at all. You come in, and then every day we learn something different, and every day you build and you learn and stuff. So I would say don't be stressed, don't be worried. If you're someone like me, I was not the most organized person coming in. I can still remember back giving presentations of patients and going all over the place, and my attending be like, wait, what are they here for? I'm like, oh yeah, I forgot that part. And so for me, that was checklists. And so I was like, how do I get like oriented, and how do I get organized? And I'm not a good multitasker. I'm sort of like you. My brain has so many tabs open at one time that I kind of get tongue-tied sometimes. So for me, I made checklists, and you can't set huge goals first. So making small like goals that are reachable makes you feel better about yourself, but also you can check them off as you go down and stuff. So it's sort of the biggest thing I advise is and also the other thing is that when residency starts, just like you said, you could blink and it's like a day later. You can blink and it's almost 4 years later and you're done with residency. So to me, it's very important to keep the relationships that you had before medical school and even before residency starts. So people that either your high school friends or that you grew up with or college buddies or even really close medical school classmates that you stay in contact. And I usually sort of encourage people to sort of reach out every month to one person they haven't talked to in a while, because at the end of the day, you have such a big family here in residency as you're going through, but it's really important to kind of have a life outside of work. And these are people who have supported you like throughout your whole life and that you'll need in the future. And so make sure you keep these connections close and reach out to them.
Yeah, those are absolutely solid points. One of my favorites is just the importance of keeping those old connections that were there before any of this. I'm really big on maintaining relationships. We're always going to be busy. We're always going to have something to do, but those people that are part of our lives, they are part of what keeps us sane. And so just keeping track and keeping up to date on people's lives is not going to be every day, and people understand that we can't always be there, but the importance of trying and maintaining those relationships. One of my favorite things to do is to check in with my closest med school classmates. One of them is in orthopedic surgery. The other one is an ED. He's a ED resident. And so we have very different experiences, and just checking in with them. My ortho med school classmate loves talking about ortho cases, and just hearing that and just feeling his joy from his experience. And then my ED resident classmate, he loves talking about ED things, very different from what I'm doing,
completely.
but feeling their joy brings me joy, and I'm able to, express things about my day to them. And it's just good to keep those relationships going, because those are the people that got me through medical school, in addition to my family and my fiance. Other things I would give in terms of advice, two big things, especially as a new
what do you
intern.
wish someone gave you?
So, two things that I want to definitely mention that people kind of gave as advice. One is to always remain humble. You are the new kid on the block. And so, yes, you're smart and you got here and you made it, but it's always important to remember that you don't know everything. I don't know where the bathroom is. And so remaining humble and knowing that you can learn something from every single person you come across in life. Not just the other physicians you're around, but also your patients, the staff members, the nurses we work with. I love just approaching every relationship and every interaction, knowing that I can gain something from this. And so just remembering that the arsenal and the box of knowledge, it can never be too full. So remaining humble in that aspect. The other thing that's important as someone who would be coming in as a new intern is to remember to not be too hard on yourself. For me, I am a very just task-oriented person. I love my checklist. I love being on top of everything. That was me in med school. My classmates would always have questions about things, and they're like, we can ask Dami. She'll know the answer. And so just being on top of things is something I pride myself on. But with residency, it's a lot of newness, especially balancing residency with everything else I have going on in my personal life that I don't want to fall apart. And so just knowing that I'm not always going to be on top of it. And so I don't need to beat myself up about it, because it's okay to not always be perfect. Just don't be too hard on yourself. If an attending asks you a question and you don't know the answer, you know what? It's okay. Do your due diligence after that to find the answer and then move forward from there. It's all a learning experience. So those are the two main things. And then my advice to people who are thinking about a career in OBGYN, the biggest thing that keeps coming up, that I have a lot of mentees, and I try to do my best to give back to those that are trying to get where I am, the same way people that are where I'm trying to be have always reached back to pull me up. And so one of the things that comes up with my mentees a lot is the fact that people try to discourage them from doing OBGYN. That truly breaks my heart because maybe I'm biased, but I think OBGYN is easily one of the best specialties ever. And it's something that brings me joy. And so for someone who thinks they want to do this as a career and for other people around them to discourage them from that, saying, oh, are you really sure you want to do that? That really makes me unhappy. And so being that person to advise them and saying, if you feel like this is what you want to do and this is what your heart is set for, this is what you want to dedicate your life's work to, wake up every day and do this and not feel like, oh, okay, I got to go to work again. Literally having joy in your heart to do this every day, then stick with it. Don't let anyone's experience or anyone's opinions change that for you because you know you better than anybody else. And so focus on the positive. No specialty is perfect. And so focus on what brings you joy in that specialty and don't say no to OBGYN just because someone else, even maybe other OBGYNs try to, discourage you and tell you not to do this. What's for you is for you. So whatever career you are meant to do is for you. So that's my biggest thing. Snaps all day.
That was great. That was so good.
Well, and I think you all touched on this, but I think it's so interesting about how our department and our residency program really is geared towards training you to be a leader. You talked about having mentees. You've talked about people that are in your life that are feeding into you. And so do you feel that the department is preparing you for leadership, from the very beginning in small ways and big ways? And talk a little bit about what that looks like to be a leader, both through residency and as you're thinking about your future career.
For me, leadership has always been a part of my trajectory. As I mentioned earlier, most recently I was very involved in the Student National Medical Association, which is an organization that serves to support minority students in medicine. We're welcoming to minority students as well as other individuals that want to be a part of the cause. And so serving on a chapter level, on a regional level, and then my most recent role towards the end of medical school as the national treasurer of the organization, leadership is in my blood. And coming to an institution that encourages that and fosters that is very important. And that's what Emory has been for me so far. For me, the role Emory has played is showing me great leaders that I can strive to not be, but to be like. There are little things I can take from everyone. Our current PGY4s, our current PGY3s, our current PGY2s. Everyone is in a different spot or place in their training, but I've been able to take little bits and pieces from everyone's personality that I feel like would make me a leader in the field in the future. And so say as a PGY4, I'm new to that, 3 years or 3+ years down the line, I will be thinking about things I've observed in my other chief residents, like from years back. And then also just seeing great leaders in different departments. And so as I mentioned, our program director, our new assistant program director, seeing those individuals leading by example. That's key. Oh, yeah. Someone can sit here and tell you, okay, to be a leader, you need to do this, 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 and this. But seeing it in real life every single day for me is what makes the biggest difference. And I've seen that so far.
Absolutely. Yeah. Looking back, trying to answer that question, I think about my leaders that I looked up to as an intern and I've kind of used some of what they had done to be kind of the leader I am. I think that being a resident itself in this department develops you into a leader. Sort of you have to. Even if someone who didn't have leadership skills coming in, I'm sort of like you. I was really involved with sort of sports, like organized sports teams growing up and organizations in college and medical school that I just wanted to be an advocate. So, and that was an easy route. But for residency, you can not only be a leader sort of in your rotations, but you can have opportunities to serve on committees that you want. You just have to ask somebody for committee. And we've already talked about how easy it is to ask people. But if there's something that you're really passionate about, there's multiple committees that people will be happy to have you. You have, but going back, I think, to sort of the rotation, every year you sort of have more and more expectations and that you sort of learn from and sort of nourish into a leader. And so obviously it's going to be the chief of service who's the leader. And, we have, there's always always constant communication with sort of the chief residents where you send the schedule for the week, you assign cases. But I'm a big fan of also leading by example. That's sort of what my leaders that I worked with, and that as a fourth year now that I use on all my rotations is I'll jump in there and do what I need to do to get things done. Things that I was, really important to me is education. And so I really try to make sure that I spend time that. And one thing is whenever we're having that free food, sitting down with medical students and residents, co-residents to talk about topics or whatever.
Yes.
So being a leader teaching you sort of lead and teach by example and stuff. So so putting a foot out there first, setting expectations, learning from that.
Yeah, absolutely. So to segue a little bit, we talked about how wellness is just really important, especially when you're a busy resident and just keeping track of how things are. So here at Emory, we have these new wonderful Wellness Wednesdays. I love the name. Love it. So being that you've experienced how wellness was approached prior to this year, and then knowing what the goal is with these wonderful Wellness Wednesdays, what are your thoughts on how that experience has been and how wellness has been encouraged in the past?
Well, I think the answer to that question, you probably asked my teeth. I don't think I went to a dentist the first 2 years of residency. That's kind of embarrassing, but there's just, there wasn't a lot of time. Last year, the chiefs did an amazing job orchestrating these wellness days that we had dedicated time to go do personal things. So whether to get your oil changed, that my wife won't yell at me anymore for not doing, or self-care with being a dentist, or getting contacts or whatever, where you can see to actually take care of patients, is really important. So we sort of last year had wellness days that we had time to go and do these things, which was great. For now, I think for organization, now that you've done wellness days, that everyone has the same Wednesday off or whatever. So if you wanted to do something with your co-residents, I think that would be a great opportunity to do something. Plus, we know the days now, so we can make these appointments and schedule now. So I really love the department's support of resident wellness, and we have sort of a wellness committee here. Going back to committees and leadership involvement, that they really do a great little time of doing different things to sort of increase wellness in the residency program, whether that's painting sessions or out bowling events or outing events, or just guided meditation we've had in the past. All those together, just sort of self-care is really important. So it's been kind of great to see how those have changed. We have people from Dr. Sri Hill is amazing coming in, and she has a big heart for resident wellness and advocates that for a ton. And so being able for her to come in and really be an advocate of letting us have opportunities for resident wellness, having other departments come and talk to us with sort of faculty student assistant program is great to be able to. I think a lot of people in our program have a counselor they can talk to, and for spouses too. So having avenues and ways to de-stress is really important. So I'm so proud of our program for incorporating that.
I'm very excited for Wonderful Wellness Wednesdays. And I think it's the point that you made about the fact that we know the dates in advance. That's huge, because as physicians, there are just a lot of things that we have to prepare for well in advance. And so having those dates and knowing you can set this appointment on that day or set up a brunch with your co-residents on that day, because we're hardly ever in the same space except for didactic sessions. And so I think that's really key. And even the fact that it's not encouraged that you have to be doing something on Wellness Wednesday. You have the day regardless. So if your self-care is doing nothing, you can do that too. And I plan on doing that quite a few times. I love doing nothing sometimes. Awesome. So speaking of Wednesdays in particular, Emory, I think, does a great job with protecting education and didactics and encouraging residents to not feel like they have to be on all the time. And so we are supposed to sign out our pagers on Wednesdays when we go to our didactic teaching sessions, grand rounds, things like that. So give me a bit of your perspective on how that's been over the last 4 years, and things like presenting as a third year for grand rounds and presenting your research projects on these days, and how supportive and how supportive the department has been with all of that.
Yeah. So not only as a department, not only with faculty, but also the upper level residents have been in things. So you sign your pager out to either an upper level resident or a fellow. Typically a fellow, our faculty member who's covering the shift that day. It's dedicated time. This is your job to learn. It's 4 years. Learning education is a key part of that, especially with your CREOGs and your boards later in your fourth year. So that's very much important. It used to, seeing an intern's pager go off in grand rounds, I'm like, what? You're getting consulted? No, it's our fault, because we want to make sure it's, that we're covering that. So, you have more and more responsibility, I think, as you get further along in the training. So as an intern, we don't want any pagers going off. We want you to learn, being able to ask questions. Same thing with second year. In your third year, you have an opportunity to give a grand rounds presentation, which is, I would say, my favorite grand rounds of the whole year. It's over the summer. It's where the third year class does a sort of required grand rounds presentation that you pick a mentor and you pick a topic that you're passionate about. So this is something that you either see a knowledge gap or that you just are just very motivated to learn more about, that you spend a great deal of time case by case. I mean, I really wanted, for example, to look at male infertility. Being someone interested in REI, that was one portion I didn't know as much about. So I worked with a mentor, with Dr. Kawas, sort of reached up to her and she's like, great, I'd be happy to do that. So, and Dr. Mehta, in the urology department as well, even outside of the department of OBGYN, you can have mentors from all over. So, but yeah, no, I put that together. And you get feedback too, so everyone does surveys, and you can see like, oh, well, you probably talked too fast here, or this was really great. This is a great presentation. Oh, you made us talking about men in OBGYN actually interesting. Some of the comments that you get. So no, that was really a great opportunity.
I remember I was here for that talk last summer. It was good. It was good.
And my wife and daughter came, and you have so much appreciation and everything for the department for doing that. And then just sort of afterwards, didactics. I mean, I think in the beginning of the year, it's to teach new incoming residents high yield topics. And then later on in the year, we're sort of teaching for CREOGs. That's really important for us. Our residents do really good on their CREOGs here typically. And I think that it's because of our education committee, going back to committees of residents getting together and making topics to talk about. Yeah. And then usually afterwards, there'll be, other sessions that you can go to, whether it's COPO conference or, sort of our combined neonatal conference that we have with our pediatrician and our NICU colleagues, that we can kind of go over upcoming cases and things that sort of went well, and kind of give that feedback as well. And it's educational too.
And Simulation Wednesdays.
Love
Simulation Wednesdays.
Love that. So, once a month or so, we have Simulation Wednesdays that we get to go to the main campus, to the simulation lab, and get hands-on training, whether it's laparoscopic technique or second-degree lacerations on using pig tongue or whatever. Oh, yes. It's all kind of things.
Oh, yes. As someone who loves to operate, I love Simulation Wednesdays, getting my hands busy and just getting used to the things that we do without it being a high-stress situation. And so just getting comfortable initially, I think, is big. And then watching, the grand rounds presentations and the research updates as an intern is very exciting and very encouraging, because it has me thinking, okay, wait, what do I want to do for my grand rounds presentation in a few years? Or what do I want to do for my research topic? And watching, my upper level residents do so well, it makes it clear that you are well supported through the process. And so I feel like I have nothing to worry about when it becomes, my turn to do that.
And that kind of goes back with Emory supporting residents. They sort of put you on a timeline. I mean, you have, presentations of your research project on Wednesdays that you're like, okay, someone even as a procrastinator like I am sometimes, I'm like, okay, I got to get my stuff done so I can present here. And so there's checkpoints along the way.
Yeah. Yeah. So accountability. That's a big thing. Accountability. I love that.
Well, I definitely want to ask you, now that you've had this sort of dedicated time to really talk about and think about residency, which I think is really interesting, right? Because you're just doing it, you're in it. And so now you've spent some time this morning sort of thinking about it. Is there anything, as far as your final thoughts about sort of what this program is meaning for you, doing for you, and sort of any sort of last thoughts that when you think about someone listening to this, about our department, about the program, that you would want to leave them with?
Ooh, I'd love to go first for this question.
Absolutely. Go ahead, Dr. Neblett.
I'd love to go first. So it's sort of a circle coming back around now for me, that having an opportunity to early exposure coming in as a med student, as visiting here, and knowing that I knew what I was getting myself into, and the interview here, I ranked Emory number 1. I wanted to come to Emory, and I still remember my match day. I still remember being with my family, getting the white envelope, opening it up, and seeing Emory there, and screaming, jumping, crying. I don't even know what emotions was going on at that point. And I remember that excitement, and I can honestly say, 4 years later, that I am so happy that I'm here, and that I love training at Emory. I think there's challenges anywhere that you go, and I think residency itself is a challenge, but I've had such great support, and I have had just opportunity is, I keep going back to that, opportunity and support from this, from not only the department, but my co-residents, that has left really an indelible impression on my life, that kind of looking back, and looking to the future, I mean, this is going to be a time that, I mean, I think I may miss residency. I mean, we'll see. Like,
I'll check in with you in 15 months.
Yeah, we're like, oh no, I know. Obviously it's it's a lot of work, but I'm so happy that I came here to Emory. I love Atlanta. It's been a great. It'll be a great 4 years. It's been a great 3 years so far for my family, having exposure to everything. And mentors, going back.
Yeah. I'm a little closer to that, MASH day situation. And I too remember the emotions, even the night before, like, tomorrow's D-Day, reaching out to my fiance, like, oh my goodness, it's coming. And he's like, you got this. And I too ranked Emory number 1. And so he seemed to know what was going to happen before I did. He was like, no, it's going to be what's going to happen. Opening the envelope right there with him next to me, and just, I too don't remember what happened. I remember the video that was taken, and that's about it. It was just such a great day. And knowing that feeling of joy and that feeling of accomplishment still remains. When I was on my Grady labor rotation, a lot of the nurses and other attendings that I would see every day, they're like, why are you always smiling? Like, you literally always smile. I'm like, I don't know. It's just who I am as a person. And to see that fire within me still remains lit, and to see that residency so far hasn't taken any of that away, and I don't foresee it taking any of that away, makes Emory that much more of a special place for me, because the experience so far and what I see in terms of the experience to come just is going to continue to be positive. And I wake up every day intentionally saying, today's going to be a good day. Maybe yesterday ended a little rough and it was a little hard, but you know what? Today's going to be a good day. So even when those hard days do happen, which they will, I would be naive to think that they won't. Even when those hard days happen, I know there are people around me, both in the department and in my personal life, that can get me through that. And so that just makes me really excited to continue this journey and to see what lies ahead in terms of what I end up doing in terms of my long-term career. No doubt in my mind, I chose the right thing to dedicate my life's work to.
That's so good to hear. I love watching everyone grow. And as you get further along in your training, you're going to see everyone sort of grow and stuff. And I think most people are very happy to be here. So, yeah. So
the smiles will always be there. So.
Well, thank you guys so much. Yeah. I've really enjoyed hearing from you both and hearing sort of how each one of you are looking at the department and the program. It's been a really, really great conversation. So thank you for taking time with me this morning.
Yes, it's such a pleasure. Yeah,
yes.
It's great.